Now, let's talk about what else can put you at increased risk for infection. And we have a list of some preoperative conditions that can affect your outcome. And so can you walk us through these? We mentioned, I know you mentioned obesity briefly in your discussion, but diabetes is also a big one.
It's a big one. It's a source of a lot of concern. Higher average blood sugars increase the rate of tissue oxidation, which means aging of tissues, and bacteria love sugar. So with diabetes, the goal is to get optimal control before surgery and then to maintain optimal control after surgery. Now, while you're in a hospital, that's easy because I can use insulin, and with insulin, you can control sugar reliably. But when patients leave the hospital, it's very important for them to maintain good blood sugar and sort of pay attention. If they're checking their blood sugar, check it more often. Smoking is another easy one to discuss. There's been a multitude of articles talking about how smoking is a problem and how it just ruins surgical outcomes, and not just infections, really just there's a problem with smoking on every level.
Right.
Hypoxia, nicotine, malnutrition.
So if you have a patient that's a smoker going into surgery, what do you do?
Well, that's a tough question. So I will deny them surgery.
You will deny them?
With one or two exceptions. If the patient is at risk of being paralyzed, which is rare, very rare, then the patient has to understand that they're at an increased risk of an infection, but in their situation, you may have to take that risk. For the most part, I ask smokers to stop smoking for at least a month, and then we'll go through surgery with a significantly improved risk profile.
Okay. Now, when you even have a weakened immune system, though, that's a little difficult also for surgery.
Another one, but that's something where the patient really can't do anything. So, for example, I'll operate on patients that are very elderly or patients who have had weakened immunity because of cancer or chemotherapy. You have to really be objective with the risks, and you have to discuss this with patients at length.
Absolutely.
I believe in a consultatory sort of model where the patient has to be aware of what they're getting into, but sometimes there's no option.